Hi, my name is Alexa, and today I will be discussing how memory care has taught me patience and how it is to be in a safe environment while encouraging patients to be independent. If you've ever thought how a memory care unit is or what goes on inside, it's mostly a place for elderly people who suffer from Alzheimer's disease and dementia. Memory care is specifically a long-term facility who provides a safe environment with staff members which are highly trained to be CNAs and caregivers, and they care for people who have memory loss, behavior changes, and confusion. At memory care, we provide care, safety for the patients, such as feeding, showering, and dressing. It's important for us to learn how to become patient while working with people who have memory loss, because half of the time they do tend to get frustrated, and sometimes we tend to get frustrated, but we need to learn how to be patient and hide the frustration and keep it to ourselves, and while still being there helping them without showing that. So according to the article identifying individuals with high risk of Alzheimer's disease while using polygenic risk scores, it states that Alzheimer's disease is the most common type of dementia and mainly affects the elderly population. It affects the ability to remember certain tasks or what they want to say to us. Sometimes they can't really explain what they want to say. They forget half of the time, which is okay. We tend to figure out what they need or what they're trying to say. So that is why we are there to help. I experienced this during the shifts I work. They tend to forget what they're supposed to do, which is why I am there, and the CNAs are there to redirect them and reassure them with simple words or tasks. At times they want to get themselves ready for bed, get themselves ready for the day, but at times they do tend to forget what top they want to wear, where the top goes, what shoe goes on what foot, which is why we are there for standby assistance, which is called for us to be there and let them know, like, oh hey, this goes there, and while they're still learning and being independent while doing it themselves, but we are there to redirect them and help. According to the article exploring the relationship between nursing staff and family members, it states that nursing homes need around-the-clock assistance due to chronic illness and disability, which CNAs provide most of the direct care to residents, which includes assisting and notifying the nurses if they notice any changes in their behavior, how they look, how they're acting, which is all reported back to the nurse. Supervision plays a big role as a caregiver, since it is our duty to make sure they are in a safe environment and keeping it that way. It is always important for us to observe our patients while they are performing any task of their own and making sure they have that observation 24/7. It is important to observe your patients while they are performing tasks to make sure we maintain a safe environment to them and make sure that their family is getting the reassurance of just letting them know they are safe and they are being well taken care of. According to the article Alzheimer's disease and nursing homes, it states that people with Alzheimer's disease or similar dementia are at an increased risk for falls, delirium, and other negative conditions once they become residents of nursing homes. This is why standby assistance or full assistance is important to do when caring for patients with dementia or Alzheimer's disease. We are there to prevent any falls or any further injuries or any injuries at all. Working in a memory care has taught me many things beyond the workplace. It is important to actually care and show up for the patients. Every person there should be treated with patience, dignity, and respect. And what I learned in memory care is to just be patient, show up every day, be there for them, take care of them, make sure their frustration doesn't go on to your frustration, and which is not shown, just to maintain that frustration and not let it show, basically. And be very patient, because at the end of the day, it's not their fault to have what they have, which is dementia or Alzheimer's disease. And it comes with memory loss, which upsets them, frustrates them, because they don't remember what they want to say. They don't remember certain things, certain names, colors. Half of the time they want to say something, they get upset because they can't say it, it won't come out. So it's just best for us, for me, as my job, to take care of them and just reassure them, redirect them, make sure they are being kept safe, and just being there as a helping hand. So that is what memory care basically is, and what goes on inside, and how it is to be patient and take care of someone with Alzheimer's disease, dementia, which causes memory loss.